Here at the start of the school year, it's a time when many parents and many caregivers think about vaccinations, making sure that all the shots are up to date for the ones that are heading back to school. And we're going to talk about that in particular when it comes to the HPV vaccine. Dr. Mark Hunter from MU Healthcare is in the studio with me. It's nice to meet you. Thank you for being here. I appreciate your time today.
Good to meet you.
Let's talk about vaccinations, and especially about this one. This is one that, when I was young, I don't think it existed. We never heard about this. How old is this? In other words, when did this come into the realm of vaccinations that young people need?
This was really being developed when I was in training. So I would say about the time that I was in residency, which would be about 2000 or so. So it's been around and certainly being tested over the last 20 years.
When we hear about HPV, when it first came out, I think it was somewhat controversial. Recap just briefly before we move into the important parts of this, why this was a controversial vaccine.
Well, I think that this is a really different kind of vaccine. Certainly, we understand that HPV is a largely sexually transmitted virus. And so, it was around the time that we began to discover that nearly 100% of cervical cancer was HPV positive, that we began to realize how important HPV was in the initiation and ultimately in the propagation of this disease. And so we eventually developed a vaccine for it. Obviously, if you've got a virus, you can potentially develop a vaccine. This is really the first cancer-specific vaccine that we've had, and certainly one that's had as much success as this has.
It has to. You're advising it be that young people, and I'm saying people because I'm surprised to know it's not just women. I mean, it's men, or male and female. As young as what age should you start to think about doing the HPV vaccine?
The HPV vaccine is approved for patients 9 and above. And so earlier than that, we typically don't recommend that. And so when you talk about and you ask about the controversy, it really comes to the fact that you're vaccinating a 9-year-old for something that for behavior, for normal, healthy living that you would hope would start sometime in the future.
Right.
But what we know about vaccinations in general is that the response in the body is much more robust as a patient is younger. So a 9-year-old will have a very robust response to the vaccine and develop a much stronger immunity against the virus if they're given it at a younger age. And I think that there's a little bit of a concern there in the community, and certainly in some parts of the community where we can't do this, we can't give this vaccine, we're sending the wrong message. And I think that's the wrong message. Mm-hmm. The right message is that we have a cancer-specific vaccine, a vaccine that can protect and prevent nearly all disease related to these specific serotypes or these specific HPV types, certainly the most common types causing cancer.
I think it's kind of interesting. I like what you just said because I think that's a really good explanation. And in my mind, what I hear you saying is you got an age that you say, well, this might be the age that somebody becomes sexually active. So let's start at that age. Let's work our way backwards from that. And not saying that you want to start 9, 10, 11. Obviously, you don't. But you're working your way back and saying, if we want protection at this age, then we better start at this age.
That's right. And so what we know about these vaccines and their efficacy is that if you try to give the vaccine after a person has been exposed to HPV, it doesn't work anywhere near as well. We also know that by far the vast majority of people will convert from negative to positive at some point in high school or college. And so if you're talking about vaccinating by the time somebody is in high school or college, you're really sort of late in that game. By no means do we suggest that somebody does not get vaccinated if they weren't vaccinated at 9. Should they get it before going into college? The answer is absolutely. If you weren't vaccinated when you were younger, and maybe you're going through a divorce, or maybe there's some changes in your life that you expect that you may have some more exposure that you didn't have as a young person, even then we recommend getting vaccinated because we know that these vaccines are effective. Now, from an FDA approval standpoint, early 20s is where it caps off. So if you're older than mid-20s, then the insurance companies won't pay for it, and you actually have to pay out of pocket.
What is the series? In other words, you get how many? Is it I don't know the terminology, boosters or doses or what?
At the moment, there are no boosters, but there are typically 3 doses. Now, that is to say that you get over a 6-month period 3 injections. Now, we have come to find that the response to the immune system is so robust in these younger patients that if you're in that 9-10 age bracket, I think even less than the age of 15, that you can actually just get 2 doses. And again, the immune response is so powerful that those 2 doses are sufficient.
So if you have the 2 doses before you're 14 or so or 15 years old, then the rest of your life you never have to get any more?
At the moment, yeah, we don't have any evidence to show that boosters are helpful.
I never feel comfortable trying to pronounce words like the second part of human PV. Say what this stands for.
Human papillomavirus.
Papillomavirus. Yeah. So when you think of that, I was surprised when I was looking up and researching this. It says here that it's a common virus. Nearly 80 million people, about 1 in 4, are currently infected in the United States. Now, see, if I were just to tell somebody that is shocking to me to think 1 in 4, but help me understand why that is not something that's like in the news every day.
Yeah, it's hard to imagine, really, when you think about that, partly because we have this vaccine. If there was nothing that we could do about it, then we would just say, well, it's everywhere, like bacteria is everywhere. But this causes cancer. This is a virus that causes cancer. Now, I will also say that it doesn't cause cancer in everyone. In many people, it's a transient infection, almost like a cold. So you get infected, your body develops an immune response to it, and then you're cleared of it. But other people will go on to actually develop precancer. Those precancers and cancers are what we detect in a pap smear. So if you're a woman and you're getting regular pap smears, theoretically, we should be able to pick up on these lesions when these viruses have turned into precancers or cancers, and which is one of the reasons why we recommend that women see their family practice doctor or their GYN doctor, somebody that can do a regular pap smear and a regular exam. The other thing that's really important to note is that smoking works with the HPV to cause these cervical, vulvar, and vaginal cancers. So people don't always associate smoking with cancers of the female reproductive tract, but actually the majority of the patients that I see with those cancers are smokers. Doesn't mean that non-smokers don't get them. They certainly do get these cancers, but smoking greatly increases those risks.
What would you say again about the importance of male young people as well as female getting this shot?
I think that the incidence of penile cancer is definitely HPV positive. It is not universally HPV positive in the same way that cervical cancer is. But really, when you think about the fact that these children really will go on to have relationships, and those relationships will be susceptible to cancer, we know that we can eliminate viruses from a society by herd immunity. So when you give an immunity to everyone you can, what you do is you develop a situation where you nearly rid the community, the entire population of those viruses. That's not possible without vaccinating the males. And so really it's a responsibility thing for a parent to decide to give a male the vaccine. Not only are they being responsible with the entire community and trying to rid us of this deadly and costly virus, but also they're protecting their child and their grandchildren. If your grandchildren are protected, if their mother is protected from cervical cancer because you vaccinated their father at the age of 9, then you are helping to keep your the mother of your grandchildren alive and healthy, for many, many decades to come. And that's something that people don't think about when they're faced with vaccinating their 9-year-old boy.
Yeah, you're right. This is one of those, like, if we get a flu shot, we don't want to get the flu in the next few months. But this is one that when you get a vaccination for HPV, you're looking at something down the road decades from now.
That's right.
And so that's why I guess people have a hard time seeing it ahead of that. Is it required? Is it when you, I'm trying to remember right now, our daughter just went through registration. You always have to show your vaccination record. Is it something that most school districts or schools are saying we need to see that you've had this?
No, actually, because of the controversy that has surrounded it, there are there's only really a couple of places in the country that have tried to require it and had such backlash about that attempt that they've backed off of that. And so at the moment, I'm not aware of any school districts in the country that are actually requiring this vaccine.
But what I'm hearing you say is that you should have this conversation with your pediatrician.
Oh, absolutely.
And they should bring it up maybe and initiate the conversation.
That's right. And as a subspecialist in GYN oncology, I'm at the other end of that spectrum from pediatrician, and I still have those conversations. I still see, people, younger people. I even see older people who are, like I said, going through a divorce or something. And under those circumstances, anyone I see that isn't vaccinated that would be of benefit, we try to give it.
Anything else you want to say about this? I think it's been very informative. I've learned a ton about this today.
No, I just want to impress upon people that there is at present no data to suggest that these vaccines are harmful in any way. I know that there's a lot of people out there who have heard a lot of stories about people that have developed problems associated with vaccines. These vaccines have, other than some mild reactions that can occasionally occur and rarely when you're given the vaccine, there are no connections with other significant forms of problems. In other words, you can't give and I can't stress this enough, you cannot give your 9-year-old autism by giving them the HPV vaccine.
Yeah. Dr. Hunter, thank you. Appreciate your time today.
My pleasure. Thank you.
From MU Healthcare, Dr. Mark Hunter talking about the HPV vaccine and the importance of making sure that young people and even older people under certain conditions receive that. It's Newstalk 1400 KFRU.